Katherine Hill Ritchie of Nottingham Spirk, along with two great family offices that have experience in investing in healthcare as impact investing. And Katherine, would you like to lead us off? We will be co-hosted by Katie Richardson, who, for technical issues, she hosts our pitch club, and so she's familiar with the platform. So if we continue to have technical issues, hopefully there's somebody there that can give you a hand, Katherine. But otherwise it's all yours. Please lead away.
Great. Well, welcome everyone, and a big thanks to Coveted and Michael for this invitation. I'm Katherine Hill Ritchie from the Nottingham Spirk family office. I also have my own firm, Private Capital Investments, and I'm a member and representative of ShareNet. Today we have Jamie Rhode from Virtus Investment Management and Kevin Schimelfenig from McGeever Capital. All three of us are from family offices, and we all invest in healthcare, but in different ways. We have a limited time, so let's just go ahead and jump in. Why don't I start with you, Jamie? It would be great if you could tell us about how you invest in healthcare. You know, what structures, what stage, how much capital, are there things you focus on or any areas that you avoid?
Great. So for us, we're a single family office. We invest across all the alternative asset classes, but most of what we do is through funds. We do not have the expertise or the capabilities to underwrite individual opportunities, so we underwrite through funds. About 15% of our capital is allocated to private equity and growth equity. And specifically in growth equity, we target software and healthcare specialists. In healthcare, it's really healthcare services. We feel like in growth equity, healthcare has the ability to outperform. And then in regards to venture capital, which is another 15% of our asset allocation, we specifically target funds writing the first institutional check into a startup. And there, about a third of the funds that we invest in are on the life sciences side, specifically in therapeutics. We feel that, advances in genetics, advances in therapeutic modalities, leveraging artificial intelligence are really three areas where we find the capabilities for us to invest and have strong financial returns. It's really interesting in life sciences when you compare it to general tech and early stage venture. Only about 2% of startups in general tech become an outlier, but in life sciences, it's actually about 10%. And you're getting a lot of exits through big pharma who really have outsourced their R&D to M&A. So you're actually getting DPI, and it's occurring sooner rather than in general tech when you're, waiting 10 to 15 years.
Yeah, that's a really great point. Kevin, we'd love to hear from you. Again, same thing. What do you look for? How do you structure it? What stage? How much capital? And areas you might focus on or avoid?
Sure. So first, thanks very much for having me. I really appreciate it. Sorry for I'm getting a tremendous. Are you hearing that?
Yes.
Yeah, there's a lot of echo there, Kevin.
I don't know where that's coming from.
Oh, it's gone.
So now.
All right. Sorry about that. I don't know if it was me or not. But anyway, we're a first-generation single-family office. We're in North Carolina. A little bit like Jamie, our split is about 70-30. We're mostly in the medical device diagnostic space. That's where we made our money. So the lion's share of that is in that space. The remainder is in real estate, and that's more of a long-term prevention or capital management allocation issue. We like to invest where we know our investment activities are very specifically in two areas. We like very early stage companies that are coming up with new novel technologies. Again, medical device and diagnostic focus. We also like going after mature existing assets in corporate America. So we like to go in and help take over assets that are no longer appreciated by our corporate partners and actually bring them back to a healthier state in performance. In doing so, that allows us to have two fundamentals. One, we actually have de-risked an asset by getting an asset that's already FDA approved, already has a reimbursement, already on a contract, and already has a tremendous brand equity. So that allows us to be in the marketplace with a pretty de-risked investment. We also bring that to other family offices where they participate with us as well. So we do that in direct command and control of the commercial efforts there. But more importantly, that allows us to understand what the corporate partners are looking for, where they're evaluating their portfolios, which allows us to go way upstream, look at early stage assets, and know that that particular product or that startup company does have a place to fit in the portfolio of one of our corporate partners. Our financial appetite can be anywhere from, $50,000 to $100,000 in an early stage company, all the way up to somewhere between $5 to $15 million in a maturing activity. Our background is we've been doing it for close to 15 years. We've probably done over 100 deals in that capacity in some way, shape, or form. We've got great corporate partnership and relationships with a lot of the larger companies. We also have a very active angel network around the country where we're involved both as direct angel investors, but also through funds on the West Coast, Midwest, and the Southeast and Northeast as well.
Oh, that's great. Thank you, Kevin. So just a little bit about Nottingham Spirk for those who don't know. It's a Cleveland-based family office who own a 50-year-old industrial design firm. Because our founders are very much focused on hardware, we also are in medical devices, but also I would say diagnostics, but also related. For example, we created a telehealth booth for Walgreens and things like that. So we can work with very early stage companies, even do tech transfer deals out of universities, and we can be the first capital in. But also, since we have an industrial design firm of 75 engineers, we can actually help with the actual physical product development, take it through FDA. And through to commercialization. So I would say really, our focus is more hardware. We will do, IoT robotics, but we're never going to invest in a pure software company or pure services company. And it's all 100% of it is direct. But I would say we have a new interest in co-investing now with funds. So that's been rather new. So let's move on. Next question. Kevin, why don't we go to you? How important is social impact or the focus of the company on your investment selection process?
It's interesting. So, when I think about family offices, a lot of times when they originally get into healthcare, it's because someone in their family got ill and suddenly they find a disease state and they don't like the quality of the care. So from our perspective, unfortunately, we are in the medical device space first, but we did fall into that category. So from our perspective, we are looking for certain types of technologies. Like a great example is, we have a recovering cancer patient who has a bout with lymphedema. So we very much look for lymphedema type product lines. So from our perspective, it's very important to look at that from an aspect. We also like the fact that we've delivered product lines that wouldn't be in the positions they are today if we didn't invest in them early. And the great example is, one of the companies one of the product lines we worked with was with one of the larger manufacturers that neglected product line that was doing less than $10 million. We came in, invested in it, took over, completely built the commercial team, built the product line up to about a $350 or $250 million business. Today, that's doing over $1 billion, and it was direct impact and allowed them to be able to perform when COVID hit. So this was a great product that was going to be mothballed unless we stepped in and got involved. But because we got involved, it allowed them to be positioned so that when COVID hit, they were able to tremendously help the world as a large capacity. So, we like to go back and think and say that, boy, if we didn't do that back then, there would have been a lot more difficulty with what they did and their ability to perform in COVID. So we do look at those opportunities, tremendous activities, and look at how to do that. We also look at where patient and healthcare is going and try to align that as well. So like we like robotics, we've done projects with that type of activities as well, and we see it improving. So, it's more of an issue of how healthcare is evolving, and I do think it's becoming very consumer-centric, if you will. Once you get involved in the healthcare system as a consumer, you have a whole new attitude towards healthcare. And I think that happened to us as well. So that changed our, besides being just capitalistic and how we went after our investments, the fact that we had direct personal interactivities with that helped us become more acutely aware to how we could be more impactful socially.
Well, that's great. And by the way, Kevin, let's talk after because we worked on a lymphedema product.
Yeah. Excellent.
So,
Loved it.
Jamie, let's go to you next. Again, how important is social impact or the focus of the company on your investment selection process?
So we're definitely uniquely different. There's a philanthropic part of the family office, but that's not the capital that we manage. So specifically for us, especially in early stage venture, the goal of that bucket is to compound the family's capital for another 200 plus years as we manage capital for generation 7, 8, 9, and we're planning for 10. So there's definitely been healthcare issues along the generations, but for us, it's purely meant to compound capital, but that also aligns well with, doing social good. We really focus on therapeutics specifically in early stage venture because of the financial returns that it offers. But there's over 7,000 rare diseases and 80% of them have a genetic underpinning. And we're seeing a lot of advances in therapies for rare diseases because of this genetic underpinning. So for us to invest and receive strong financial returns, but also do social good is two benefits, and it obviously helps. But this area is really specifically for us to compound, that family's capital. And with the technological advances that are occurring today and the cost of, gene editing going down, it's interesting where we've expanded our approach, where before we were solely focused on fund managers taking purely science risk, but now, synthetic biology is out there, computational biology. It's really, increased the scope of where we can invest and where we can really compound the family's capital.
Yeah, understood. People ask me about that a lot, about if our healthcare investments are impact. But in a way, we kind of feel like the medical devices that we focus on are usually very disruptive. We're trying to find something that is not even available yet and is going to save people's lives or make people's lives better. So in that sense, we think of them all as impact investments. But I would say, that's the thing though. Sure, we can make medical devices for plastic surgery. There's nothing wrong with that. We haven't done that yet, but most of our devices have been really to, make human lives better, last longer, be more comfortable. So we see that as an impact investment. So let's go on to the next question. Kevin, what are the future themes in healthcare that you are watching?
So we see a ton of different things. So fundamentally, I would tell you, as I started to comment earlier, is a little bit around consumer side. I think as more of the population gets involved and becomes consumers in healthcare, they're just fundamentally getting an education they didn't expect. So they're starting to get more involved. I also think the fact that you have, things like the internet, I know the worst thing you could do is go Google disease state if you've been diagnosed, because they will tell you a million things that you don't need to know. But the fundamentals, patients are now walking into doctors' offices and they're saying to he or she that they just know all this information and putting the doctors on their heels, where that physician, he or she is overwhelmed by the amount of data as well. So we do see a tremendous ability for patient records, things of that nature from a software aspect. We do think fundamentally, though, in just basic medical devices, we think there's a big disconnect between IT-related medical devices and taking an existing medical device and giving it connectivity. We think that is just improving an existing technology. We think a lot of people are missing that. They're going to creating a widget, and you could see very carefully, like where certain IT-related companies have stepped into healthcare. And if you make a mistake with an iPhone or something, no one usually dies. But with some of the procedures and products we're involved with, if you make a mistake on the table, the patient's going to die. So there is no rebooting of that computer. So you've got to look very carefully at how you're doing. I think a lot of IT companies are staying away from that hardcore into the patient. But I also will tell you, a lot of the technology we have in healthcare is fantastic, and bringing more connectivity to it is becoming a wonderful thing. So we see that as a huge aspect. We also see the robotic surgery aspect as well. We see surgical procedures being able to be done by physicians remotely, which we go back and look at like the military, being able to conduct a surgical procedure with a surgeon safely behind combat lines, if you will, due to lack of a better term. We think that technology is great, because then you're going to be able to apply it in the United States, where you'll have rural community hospitals where a surgeon could operate from a major city but be able to help a patient in a rural area. So we see that technology as well. We also see the diagnostic perspective as well, because right now, one of the things we're getting really good at in healthcare is we're actually helping people find out they have a disease early. And when you find out early, you can cure it. There's a large portion of cancer that people have now moved it to a chronic state versus a death sentence because they're diagnosed early enough. And we think the diagnostic market is a huge place for that activity. So Katherine, we're totally in agreement in diagnostic type product lines. And candidly, our best return ever was in a diagnostic product. So I'm a little prejudiced when I use that one.
Yeah, us too. We're also looking at, really automating processes in the hospital, with sensors, robotics. We have been working on a sterilization machine, and with COVID, that became huge, but really speeding up getting rapid, immediate results bedside. So those are some of the devices and things that we've been focusing on. But what future themes are you looking at, Jamie?
Yeah, so I think, what you guys touched on kind of fits in some of our growth equity bucket, where we will be willing to target devices or, healthcare services. I think, software-driven drug discovery is really interesting. The exponential decline and gene sequencing costs, along with the rise of machine learning, cloud computing, intelligent automation. It'll really drive major reductions in both drug development cost and the time it takes to bring new therapeutics to market, which I think really helps us get comfortable, in investing in the therapeutic space at such an early stage. It's not, necessarily platform companies with binary outcomes. There's not necessarily single assets that you're betting on now. That there's these companies with multiple potentials of exit. And so in some ways, when you're investing, there's less capital at risk. I also think the COVID crisis really underscored the global need for more effective drug discovery processes to create new vaccines and therapeutics as quickly as possible. We had a platform or a portfolio company that was in the mRNA space, and they recently were taken out by Novartis, and that was at preclinical stage. So, we're seeing certain exits in areas because of COVID, much earlier, or companies IPOing at preclinical stage, which is wild. And you think about, even if they're at phase 1, they're IPOing with no revenue. We see a lot of these general tech companies IPOing with revenue but no profit. But on the life sciences side in early stage, you're getting these IPO events with no profit and no revenue. I also think advances in care delivery at scale, is really interesting. That's something that I could see occurring in our growth equity portfolio. Technology-enabled services and devices, like we spoke about before, will absolutely enable new transparency, measurement, coordination of patient care across conditions, providers, and care settings. I mean, it's a massive market. I think we spend about $3 trillion in healthcare spend per year. So I definitely see that an area up and coming in our buyout growth equity portfolio.
That's great. So I have 2 more questions, but Michael or Tobin, if I'm going on too long, just cut me off.
You know what?
So,
you're doing great, Catherine. I'm going to give you, let's do one more question. Then we have a few questions from the audience as well.
Great. Okay. The next question was, did COVID change the way you conducted due diligence on investments? So I'll just answer first quickly. Yes and no. So one of the things is Nottingham Spirk was considered an essential business because we actually prototype medical devices. So we were open. The problem was other people weren't or couldn't travel. So we encouraged people even to drive to see us if they wore a mask, and vice versa. But we did end up doing just a handful of deals, sight unseen, not in person, which is kind of unusual for us. But also we're able to have people send us prototypes to the office safely, so we can actually physically look at them. So, I think for us, it was, we had to adjust it slightly, but I would love to hear, Jamie, how about you? Did it affect your due diligence?
It actually gave us pause at first, just because typically we would always meet with an investment manager prior to making an investment. But what we realized is that can actually create some biases and impact our judgment when making those investments, maybe because they were having a bad day, or we judged them based off the clothes that they were wearing or the art that was on their wall. And so what we realized is we needed to readjust our process, and being so data driven over the past 5 years has really helped us do that. So the beginning process was a lot more data driven in identifying if the investment made sense within the family's portfolio. Then we absolutely moved references up front and realized, now that we've made a handful of investments virtually, that we actually get to spend more time with the fund manager than if we had visited them in person, because we're doing a lot more Zoom calls and they're a lot more available via the phone versus, meeting them in person maybe once or twice for a couple hours. So, to your point, yes and no. It just had us revamp our process and realize the benefits of, doing virtual due diligence really allowed us to reduce the bias that ended up being created that we never wanted to be created in the first place.
That's a great point. And finally, you, Kevin.
Yeah, I kind of think of 3 things. So first, when we look at a potential partnership and their manufacturing capacity, one thing that came vividly clear to us is how well are they handling their ability to interact with COVID-related issues in their factory. So we had an investment that damn near shut down because the factory got infected with COVID and they could not produce the product. It had nothing to do with anything else. The second issue we found out was in the healthcare space. Healthcare is used to dealing with disease states. I remember being in surgery every day when AIDS first came out. Gives you an idea how old I am. In the hospital environment, people are like, oh, it's an AIDS patient. Should we act differently? And the fact is, no. Every patient is treated as if they're at a tremendous risk from infection as a healthcare giver or provider. So in that environment, we're used to dealing with that. So I think hospitals sobered up and said, wait, we're used to this activity. We're just suddenly shocked by that we have a new one. And then lastly, and probably the most important thing, is we also recognize when investing in healthcare devices, the elective surgery component of the hospital business became so critical. Hospitals realized they had to get back to work or they were going to go out of business. So when we're looking at some of those product lines, where they sit in the hierarchy of the hospital activity becomes critical, and looking at certain procedures and the product lines that support that procedure become mission critical. So understanding where the hospital is when something of this, this devastating of an activity hits with the COVID activities, where is the hospital and what they're doing and what products are we involved with that actually are going to be sold, used, and deployed every day under any circumstance. And so we found that to be much more helpful from a due diligence perspective as we're looking at product lines.
Great. So we have some questions, Katie?
We do. We have several questions actually from our audience here. So the first one, how best to find the specific investment targets, medical needs focus of family offices? And then is there a research tool to explore which family offices specialize in what healthcare challenges? Great question. Katherine, I'll let you go first.
Yeah, I was just saying quickly, I've been working in the family office world for 18 years. I've worked for 8 families, and some are just more transparent than others. Their website clearly says it, or they might be in Crunchbase, but others are completely hidden. So, I don't think there's one perfect tool or database. Whenever anybody says they have a family office database, I always look up myself because sometimes it has my job from like 3 jobs ago. So sometimes those things aren't very accurate. But anyway, I'd love to hear the other panelists. But, I think within the family office world, it's about relationships, because a lot of times over time they change their investment interests. Just like Jamie and Kevin mentioned, somebody in their family gets sick or something happens. And so, it's about getting to know them, on a relationship basis. But what about you, Kevin?
Yeah, people tend to forget the charter of a family office. My job is to make the family's life better in any way I can. So it's about anything they need. And number one issue is don't run out of money. So it kind of relates back to Jamie's comment. If we help make money, they can do the philanthropic things as well as the personal things they want to do. With that being said, we've actually pulled back significantly on the amount of information we're communicating to the public or putting in a public venue, because we get overwhelmed with people inquiries. And when you first start getting them, you want to be respectful. You want to respond to everyone, say thanks, but here's where you don't fit. But averaging 30 to 40 deals a week and averaging 200 emails a day, it's just not a capacity we can keep up. So you tend to not be able to respond. So we've pulled back quite a bit on what we're sharing publicly. Also, when you're a private family office, you tend to hide more than you want to expose more. Very few family offices I know sit there and beat their chest and talk about the amount of money they have or where they're investing, because the tax man cometh and all those people you start fighting with next. So it is about keeping a lot of things confidential. I will tell you, they do talk to each other. We pick up the phone and deal with a lot of family offices. So for us, we got in real estate because we wanted to partner with family offices that did. And when family offices look at healthcare, they come to us because they know that's our core competency, specifically going after de-risk deals of corporate assets. So making sure you build a relationship with a family office over a long term, that's probably the most important thing. The other thing is, if they're not getting back to you, don't get discouraged. It's your ability to follow up. Looking at it from someone looking for investment. Fellow family offices, I take questions and meetings all the time with those folks. So just if we can help them without any, there's no ties to that, just anything we do to help someone in a fellow family office, we found that to be a great way to network and relationships. And that's where great deals come in, when you get a family office calling up and saying, hey, we have an expertise in this, but we want to fill out the round. And I think, Katherine, you alluded to that. It's just a great way to do deals.
Great. So we have one more question for the panel. And Jamie, I'm going to let you go first with this one. If you were using funds for early stage investments, are your family offices contributing to institutional funds, or are you managing your own funds?
Sure. So the way our family office is structured is, I'd say every 3 to 4 years, we have an internal commingled vehicle that allows us to decide, for the next 3 or 4 vintage years, we're going to allocate this capital across X amount of funds. So for early stage venture, for example, we're actually investing in 25 seed funds from 2021, 2022, and 2023, and that's into what we would call institutional funds. We require audited financials. We do a deep dive analysis on their LPA references, legal review, background checks, everything like that. And what that does offer, even though we mostly invest through funds, is there's a lot of follow-on and co-investment opportunities that come our way. Where to Kevin's point earlier, we invested in real estate, and so we are well networked with some real estate family offices that sometimes we do co-investments with them because they have the expertise. So a lot of times we work with other family offices and can lean on them to understand if is this an interesting opportunity, or maybe it's not a fit for us, but we're going to pass it off to another family office in our network that can follow on to the Series A or B, like a Kevin, for example, that has the expertise to invest in a healthcare company, and we don't.
Great. Katherine or Kevin, anything to add to that?
Yeah, I'm happy to share. So to Jamie's point, like we have a very disciplined approach, but there's a big difference between where Jamie's talking about generation 7 and 10. We're generation 1, so we're a little bit more on the bleeding edge of what we're doing versus managing large chunks of capital. So it's a little different life cycle where we are. So we're still in our infancy of becoming what we call family office, if you will. To that end, though, we direct investment in things we absolutely understand and perhaps have direct relationships with the potential acquirer. So I can pick up the phone and say, hey, Jamie or Katherine, I've got a deal that fits your portfolio. You ought to take a look at it. That's a very attractive thing. On the other side, we do absolutely participate in funds as part of our allocation, because managing capital, once you get a good fund manager and they prove for you, we have a couple of funds where we don't do as much due diligence on them because they've already proved it in the first 3 times we did deals with them. So it's just continue on. But in the middle of that, we've actually found the opportunity, and Private Equity International just did an article on our family office. We actually created our own fund because we had so many other family offices that were interested in getting into healthcare but don't know how. So we created a small fund to do that with, where they could participate, where we do 5 corporate spin-outs under that umbrella, where we don't buy the product lines, but we get control of them. And so it's kind of a neat place where we do a little bit of a hybrid. But again, I'm going to go back to the number one thing. My job is to make sure we don't run out of money. We make sure we take care of their personal interest and take care of their philanthropic interest. How I do that tends to dictate a variety of different times. And I'll close with one really funny comment. Our very first piece of real estate was bought because one of the family children was going to a college, and we couldn't get a lease done with the building we were trying to rent from. So we bought the building. Made it a lot easier.
Very good. Well, Katherine, Jamie, and Kevin, thank you so much for being here today and participating in our Family Office Roundtable. We really appreciate it. And I know many of you in our audience today still have additional questions for these folks. They are going to be available later in the day to answer some of those questions in our networking time. So please look for them, and you can also message them if you have specific questions for them as well. Yes. Lots of applause.
Thank you.
Thank you so much.
Thank you, everyone. Take care. Thanks for having us.